Hello, everyone, and welcome back to Casting Seeds. I'm Savannah, your holistic health practitioner and host, and you're listening to the only holistic health podcast that uses God's singular truth to give you individualized discernment. I am so sorry that we missed 2 weeks worth of episodes, but let me tell you guys, 2 weeks ago, I learned that pregnant women have softer teeth and excuse me. And what ended up happening was a part of my tooth that actually was taken care of by my uncle, who's a holistic dentist, broke off. The cap that he had broke off from, I don't know, like something that I had covered from a cavity a long time ago. And a second one did, but one of them resulted, and my uncle is in Mexico, so he couldn't help. One of them resulted in them needing to do a root canal, and I couldn't talk, I couldn't speak. For 3 days, it hurt so badly leading up to it, and then afterwards I also had to heal, so I literally couldn't do a podcast episode. So obviously that resulted in people asking a lot of questions, especially online, because if you guys follow me on Instagram or Facebook, or I think that's pretty much it. Or in any other capacity, I was talking about how I did a lot of research into teeth and healing, and especially with that relating to pregnancy, because those questions come up all the time with holistic dentistry. I'm so sorry. I ate a watermelon and it's like, I feel like it actually made me choke a little bit. But anyway, so I thought today would be interesting to kind of go over that. And also I have a few other episodes coming up that have to do with like detoxing in pregnancy, because people get that confused and what that looks like. I'm actually working with Dr. Chris Molda and another practitioner. Her name's Allie, and it's really cool because I feel like we get to kind of all work together with our medical backgrounds and history and explain what that looks like in pregnancy. And then also just a little update too on a nesting party and what that looked like here in our home, and just dealing with life's stressors. So those episodes will be coming up, and all of them are going to be short and sweet because that's all I can really handle right now with doing podcast episodes. And they're going to be more general things for you guys to look into and be able to use this information to go more in depth for yourselves. But if you want, after the baby is born, we can do like full hour-long episodes. Especially, I feel like the dentistry one is going to bring up some questions, but I'm going to try to sum it up as best as I can to the best of my ability, because I want to be able to bring in modern day true science and back it up with holistic health. And of course, everything always ties back to the Lord in every episode. And let me say, not posting these past few weeks has been outrageously frustrating for me. And Jeremiah knows, because I complained every single time, like on Tuesday, like I wasn't able to record this week. And he's just been so gentle and kind and guiding me, like, Savannah, we got to put our family first. And there has been a lot, let me tell you. A lot, not just with the dentist stuff, but also with our nesting party. And if you guys could be praying for our neighbor, she is outrageous and very unkind and purposely doesn't like us because we're Christian. And she has come onto our property and filmed us and even harmed our dogs. Like, she is wild. So if you could be praying, not even just for her heart, but for our hearts, to not just be, because I can feel like I want to justify my righteous anger at her, and I should feel sorry for her more, and I don't. I'm protective over our baby and our pets and my family and my husband's stress because of this. We've had to talk to her landlord, the sheriff, our landlord. It's been like a whole thing. So if you guys can be praying for her, I don't want to say her name or anything like that. If you could just be praying for our neighbor and her boyfriend. They're also in like their early 60s or late 50s. So they're grown adults. But if you could be praying for them and the whole situation that we've had with them for years, it just kind of accumulated within the past few weeks. So, the Lord has perfect timing for everything, even when it doesn't feel perfect. Like, we we could give birth any day now. I'm 37 weeks. And so it's just kind of funny that this is all happening right now. Obviously, it's not super funny, but all I can do is laugh. So please be praying for her. But let's get into holistic dentistry and also what that looks like in pregnancy, because I think those are two separate things. And like things are just, they come up often, especially in that Facebook group that I help with all the time. So let's get into it. So let's first break down the difference between holistic dentistry, which is called biological or integrative dentistry, versus allopathic conventional dentistry. Because if we understand the base of these things, or the root, a little dentist joke, that was so bad and so dumb. If we understand the root of what the core beliefs are, then from there you can kind of decide what's needed or what's best for you in general. So core philosophy of holistic dentistry, it treats the mouth as if it's parts of the whole body. So it's not separate. It's not its own separate systemic system. It's a part of the whole body, and it's connected to the whole body, and different teeth are connected to different organs. It's actually really cool. On my website, holistic.co, under teeth, I actually have an interactive link where you can see what holistic dentists relate each tooth to, so you can kind of see if it's affecting different organs. And even I think it has a tongue map as well, which is kind of fun. So check that out at holistic.co. But ultimately, for holistic dentistry, it focuses on prevention and biocompatibility and root causes. So biocompatibility, because your mouth is the first part of your digestive system, it's focusing on the enzymes, the proteins, the bacteria and yeast, and all the different things that start your digestive system that then tracks into your body through your throat, your stomach acid, and just, all the biomechanics of how that works. And even the, your blood, right? You have really big, strong nerves and blood flow that goes in through your jaw. So some food can even be microabsorbed through the mouth and the gums in that way as well. So that's also important. And then obviously root causes. It's not just a fun little joke for dentistry. A root cause is finding the true cause of what's harming it. So if you have chronic, chronic cavities, what can happen is like people will just be like, oh, lower your sugar or whatever. But it could be so much more than that. And that's why I really love the Weston A. Price Foundation, because it was actually started by a holistic dentist at the turn of the century. And he's the one who said like food, like sugar and starches aren't the things that are causing people in the West to have horrible like dentistry issues. This is why people in different parts of the world can eat more sugar or more blubber, more fat, whatever it is biologically, because they've been generationally made to be able to eat this, because it goes with their microbiome, because they're eating locally, they're eating what they have eaten for generations. It's when you explore too much out of your gut biome that's not prepared for it that your teeth start to decay. So that's like a whole other spiel that we could get into. That's why I said doing this kind of generally can open up a lot more questions, but I do explain it a lot in the Holistic 101 and Holistic 102 episode. So go back and listen to those as well. So also holistic dentistry does often integrate natural therapies, nutrition, lifestyle, and care. So it's more of a lifestyle. It's not like you just go to the holistic dentist and then they prescribe you things and like herbs and supplements, and then you go home. That's not how holistic care works. So the overall key principles: 1, it's an avoidance of toxins. So no mercury. I don't know how to say this. It's like amalgam fillings, mercury amalgam fillings. There's no use of fluoride. And if there is, it's very limited or completely avoided. And also the materials are checked for biocompatibility with the body. I don't know if that, some people have claimed that if it's more bioavailable available that it actually can fall out a little bit more easy. And maybe that's what happened to me during pregnancy. I'm not sure, but none of that's been proven because I looked it up. Root canals also are questioned or avoided at all costs, which I have an interesting take on that. So bear with me while we're going over the basics. But root canals can be seen as a potential issue for chronic infection and immune stress and chronic inflammation because you'll have rotting tissue in your mouth. Also, number 3, it focuses on airway and bite. So your jaw and how it's aligned with your tongue pressure, your breathing, your nose, your face, and sleep and behavior all affect your overall health, stress, and digestion. So that's something that a generic dentist normally doesn't look into. They care more about the aesthetic of your bite and what it looks like, not what's necessarily best for you and your body individually. There are some that mix that up, but it's not as common. For the detoxification support. So especially if you're removing metals like mercury and things like that out of your mouth, there's normally a lot of support and detoxification after it's removed. Not just, okay, we're going to remove this from your face and then put something else there and bon voyage. There's aftercare normally involved, which is really important. And then the last thing is also collaborating with other practitioners. So normally a holistic dentist will work alongside like a naturopath or chiropractor, a functional medicine doctor, a holistic health practitioner like myself, and try to do something where it will cultivate a better overall lifestyle. Because again, your mouth is the first part of your gut. So, or even like a holistic nutritionist, they'll work with people alongside them to be able to cultivate a protocol for what's best for you as an individual. So those are all things to look for in a holistic dentist. If someone claims to be one, you can talk to them about this. So now let's look at allopathic conventional dentistry. So their core philosophy focuses on diagnosing and treating any oral disease directly. So if it's any type of gum disease, a malocclusion, I don't know what that is. Anything that just seems not good, you treat it directly just as is. There's also primarily a reactive procedure base. So like they just go into fillings, crowns, root canals, extractions, and braces. So if they see something that's off, they react to it and respond to it immediately instead of seeing it affect the rest of the body and checking in with the rest of the body first. The third thing is there's normally an emphasis on evidence-based practice as defined by the Mainstream Dental Association. So an evidence-based practice basically means if you see a cavity, the evidence is that you must not be brushing enough or you must not be flossing enough or whatever, like that's the evidence they have for it. Versus like, let's do some diagnostic tests and see what else could possibly be causing these things because they don't have time for that. So it's more of like face-to-face evidence versus in-depth evidence. So their key practices are the amalgam fillings, which is the mercury fillings used for durability. But they're not as common now. They have other ones, but that's kind of one of their key practices. Root canals are standard for saving infected teeth. Fluoride is promoted and is essential for preventing cavities. And there's less of an emphasis on body-wide effects, if none at all, directly linked with like diabetes and gum disease and all of those types of things. So holistic dentistry, why would you want it? Why would you care for it? And can you trust it versus allopathic medicine? I think when people think of holistic dentistry, they think of people in the 1930s, like getting their teeth yanked out of their head. Like people becoming gummy, or telling someone like, just drink a fifth of vodka and we'll yank some teeth out and you're fine. When that's not how holistic dentistry is at all. And then I also think that there's the other extreme of people seeing allopathic medicine and allopathic dentistry is like, we're just going to do 1 million root canals and make sure that there's a bunch of dead tissue in your face. And that's how that works. So I personally, especially having just gone through this a few weeks ago, I think that there's a lot of prejudice on both sides and they're both incorrect, like the far extremes. The same way that when I talk about allopathic medicine in general and holistic medicine, the far extremes on both sides are also incorrect. And it's good to work with both and understand both and what that looks like. So if we're going to talk about, I'm going to use root canals because I feel like that's like the biggest thing, that and probably mineral based toothpaste, which I have again under teeth, if you go to my website, holistic.co, and you go to research, I have a bunch of free research there, and I actually make a mineralized based toothpaste that's amazing that Jeremiah and I use, and my recipes there. You do, in order to get to it, you do have to have a Facebook. So if somebody doesn't have a Facebook and they want it, just email me and let me know. But I created it specifically for that Facebook group. So to get into root canals, it is not a wide practice anymore in the USA, I will say, where people literally just cut off okay, so a root canal, what they normally do is they will, your tooth has a root, right? They have roots that go into your gums and into the nerves. And that's how they get like blood flow, because your teeth are alive. They're bones that live and they have to get nutrition to them. So what happens is, because your bones are exposed, they can get cavities or rot when you don't take care of your teeth properly or your gut health properly, or even stress can cause it. There's a lot of things. And pregnancy, which I'm learning. So with a root canal, what happens, or what used to happen, is in general, they would leave the roots of the teeth. Like if the tooth has rotted and it's not doing well anymore, they would leave the roots of the teeth in so that the jaw doesn't shift. And then they put a fake cap on top. But now, regular dentists are starting to realize like, oh, it's not the healthiest thing to just leave dead tissue into your face, because that causes inflammation and all the things. So there's been a big shift, especially I think in the past like 10 years, but I'm going to say more like the past 2 years of, I would say more like millennial dentists. People are my age. I don't know who listens to this, but people my age in their 30s, of looking at mixing holistic and allopathic dentistry. And I've never, even talking to these dentists that I worked with, and even other people who have gotten root canals, I do not know many dentists now that do practice leaving a dead tooth, a partial dead tooth in your face and just capping it. I know that there's a lot of people who still do it, but technically by the Dental Association, they actually don't allow that anymore, at least in the state of California, but I was told that it's nationwide. So they will, like the tooth that I had to get a quote unquote root canal for, I got what's called a capped root canal. So both of the roots are totally fine. It was just like the front quarter of my tooth broke off. So my root was exposed and it hurt the nerve so badly. So what they did is, if I had two healthy roots, which is what they did, they cleaned out the inside of the tooth part, and they left the roots, like the blood flow there and the connective tissue, which I'm going to tell you, all of this was so painful because I opted out of any Advil or pain meds or anything like that. One, because I'm pregnant, but two, I don't believe in doing that in general. So I was just living off of chamomile tinctures for that whole week. I literally just chamomile nonstop. And it's the only thing that worked. That and putting, I have this really strong CBD cream that I put on the outside of my jaw, and it worked. It totally worked, and it was safe during pregnancy. So, but what I got was technically a cap. So if somebody needed like a full blown root canal, what's suggested now, which an allopathic doctor, I mean, they will ask you like, would you prefer that we leave the structure of your tooth in, which does mean that they'll leave at least one dead root in, but they can also put in an implant instead. So at that point, if I found out that both of my roots for that tooth were bad, I would have been like, yep, no, we're just going to extract it and put in an implant. Like at that point, just because I don't believe in having that inflammation. And it's around the exact same price as a full root canal anyway. at least here in California. But I had a cap on, so it was a lot cheaper, but still a lot cheaper was like $3,000 for that one tooth, which is crazy because my insurance didn't cover it, which is annoying. But that's a whole other topic. So there are different types of root canals is what I'm trying to say, that there are holistic ways of doing them where it doesn't leave the root fully canaled out like what is originally thought of. So again, it's a mixture of holistic and allopathic medicine. If someone just said that they were going to fully like leave a dead tooth or a partial dead tooth in there where it's no longer going to get nutrition, absolutely not. I'm not going to leave that inflammation there. But my mouth feels so much better. And then on the topic of remineralizing your teeth, you have to do that daily with the things that you eat and your lifestyle and have low stress. But this is what happens. Your body, when you're pregnant, goes under super, super high stress. So you're able to get more cavities because of that, even if you eat really clean. So that's kind of what's happened to me. And I think that's also why it loosened up my 2 caps that I have. You just heard me like, I can feel that hole. I have a huge hole in one of my teeth. It's crazy. It like the whole thing popped off. It doesn't hurt right now, so I'm going to get that fixed after. But yeah, that's going to be expensive. So it's just that kind of stuff where it's like, okay, well, God, this is what you wanted. And I can't get upsetty spaghetti about it, but it is frustrating. So with that, again, I'll have a partial cap for that root canal because now that means I have to have 2 caps. And that I'm okay with. If they end up looking at the second one where you can hear that hole in my tooth and they say that they want to leave the roots in it, then I will say no and just either have a giant gap there for a little while until we can afford an implant or whatever. But that's the dealio with that. So with remineralizing your teeth, yeah, I mean, most conventional ways of like if somebody uses a plastic toothbrush or not even just a plastic one. They have different kinds now. But if you use really harsh toothbrushes, then that can break down your enamel and actually make you more susceptible to cavities, even if you are using like an all natural toothpaste. But just because you're using an all natural toothpaste doesn't mean it's remineralizing your mouth. And also remineralizing doesn't mean you're also bringing in good bacteria into your mouth. So if you have an over acidic mouth or an over alkaline mouth, just like your gut can be overly acidic or overly alkaline. If you don't have the proper pH of yeast and bacteria in your mouth, that's going to cause your mouth to then have cavities because it's going to break down your teeth a lot more. So making the remineralizing toothpaste, which I love, is obviously wonderful and great for your teeth. That doesn't mean it necessarily supports your gum health, your proteins, and your microbiome. So with all this being said, the biggest and most important thing, like if you wanted to really get into your dental health and your care and really like look at your gut from a totally different perspective, you can go, I mean, my dentist does this. You can go do a spit test and check out the pH of your mouth and figure out with a holistic dentist or even with someone in naturopathic medicine, how to fix the pH in your mouth and what that looks like, whether it's a diet, because this is what you have to get checked. You have to see, is it a dietary issue? Is it a stress issue? Is it a lifestyle issue? Do you sleep with your mouth open? Is it a breathing issue? There are so many aspects to that could be affecting your mouth, and a regular doctor is not going to be able to help you with that. A regular dentist can and won't, because that's not what they do and they don't care. I shouldn't say they don't care, but probably most of them don't. So looking at holistic dentistry, it's good for people to remember and understand that when you are looking into this type of medicine, you need to advocate for yourself that you want to understand the bacteria, the saliva, how much you have, how little, what is generally good, but then compare to yourself and your life. And if you feel like the practitioner you're working with is just generalizing everything and not then bringing it back to you, then they're probably not the best practitioner for you. So I hope this is all making sense. And I hope it's simplifying it enough where people don't really want an in-depth episode, because I feel like sometimes if we go too in-depth, it just gets confusing because then it gets really, really overly specific and people think they have to be within like this one little niche category, and that can be overwhelming. And that's the thing. You may be praying about this and be like, oh my gosh, actually, yeah, dentistry may be the first thing that I should be looking at with my chronic gut health issues. But for me, that wasn't the issue I was having. For me, I had to look at things actually at the other end to be able to work my way back up, right? When I found out I had candida and yeast infections in my stomach, I had to look at things vaginally and rectally first. So obviously it's all connected. I wish that GI doctors and dentists and even like OBGYNs and I wish all of them were just under one roof, because I think personally that they should be. Also, can you guys hear? Do you hear this? I'm on my yoga ball. That's where we're at right now in pregnancy. I'm on the yoga ball. But yeah, so that's why I feel like sometimes when it can get overly specific, people then think like I have to be in this one category. My pH has to be like this, exactly like this. And it's not true because of your body type, your gender, which there are only two, male and female, and your age, all of those things, and your hormones, all of those can be affected. So I thought personally, that's why I think this general episode makes more sense, especially for you guys as my listeners, to then be able to tailor it to what's needed for you. But now I want to bring this all into pregnancy and what's considered safe or non-safe, because people were really shocked that I decided to go through with like that the topper root canal, especially pregnant. But it's like, what else? What other choice did I have? I was in so much pain. I was crying literally day and night. My face hurt so badly. I couldn't eat anything. It was difficult to drink, and that's not safe or healthy for the baby. So ultimately, I had to make a decision of what was going to be best for baby and I, and for Jeremiah to not have to deal with. So let's talk about what's generally safe for pregnancy and then how to be able to make a decision from there. But I'm really happy I made that decision. I couldn't even imagine having, or like the chronic stress that put me in, that could have put me into early labor, which at that point I was 35 weeks, and that would have not been great. So holistic dental practices during pregnancy. These are the things that I encourage and would love. Gentle cleanings. A regular cleaning is totally fine. Obviously, non-fluoride toothpaste. You can do herbal rinses or saltwater rinses and things like that. But yeah, keeping it localized. You can even do some ozone therapy if you wanted, which is like it's like a microbacterial balancing of the body. And that's obviously very safe when it's localized just to the outside part of your teeth and your mouth, and keeping from swallowing anything that could be harmful. Not like a lot of herbs are, but yeah, just being really gentle. And it should be encouraged to do those cleanings during all trimesters, or even just like general flossing, general brushing. Also, using boar's head toothbrushes and wooden toothbrushes over plastic, because those microplastics can be ingested, which is not great for your hormonal function. So I have a link, actually, again, if you go to my website and you go to my Amazon swap shop, if you go to teeth, I have a link of the toothbrushes that I love. And also everything that you would need to make your own mineralizing toothpaste is under that link as well. So yeah, nutritional counseling. I know this sounds so weird to talk about for pregnancy and teeth and all that stuff, but it makes sense. If you think about your body, again, in your mouth being the first part of your digestive system, you should be taking a certain amount of calcium, vitamin D3, and K2, magnesium, collagen support, all those things that the baby need, but also those things all support your oral health, and also getting out in the sunshine, right? Not just fake vitamin D, but getting out into the sun is actually really healthy for your bones and your blood flow. Movement also helps as well. So addressing blood sugar is also really important. If you have a ton of high blood sugar, like gestational diabetes. Remember when I couldn't say that, you guys? I'm here. I did it. Gestational diabetes issues, or just diabetes in general, that can really, really affect your blood health and inflammation. Because again, chronic inflammation, chronic stress, it shows through in your breath, in your teeth, in your tongue, in lots of different ways. So normally when people have like uber bad breath, even after they've brushed it, there could be a yeast and bacteria infection, but that's also normally equal to a lot of chronic stress. Another thing to mention, a non-toxic procedure, like guidance in general. So again, seeing holistic dentists that are going to choose things that are bioacceptable for your body, doing pregnancy safe toothbrushes and mineral toothpastes and mouth rinses. So like no fluoride, no excess alcohol or SLS. All of those things are going to be really important for keeping up breath, mouth, oral care health, but also helping, like allowing a holistic dentist to kind of figure out what would be best for you and most important to focus on through each trimester might be good. So also, just to address essential oils really quickly, essential oil based rinses like clove or myrrh, or people use peppermint and things like that. I have a whole episode about essential oils, so please go back and listen to this. But I will never, ever be a fan of people ingesting essential oils, especially when they are considered, when you make them, a stimulant. Even if it's a relaxing herb, it's considered a stimulant because it's meant to be put in the air vapor, which it has to be a stimulant for it to be able to do so. Instead of using essential oil, if you're going to do it, please dilute it with other oil. So that means like in a coconut oil. Please don't though. If you're going to do it, do a tincture. A tincture uses the whole plant. So like use peppermint tincture instead of peppermint essential oil, or a tinctured clove or tinctured myrrh versus essential oils, which also the tinctures are cheaper. They're cheaper. They use more of the plant. You're getting more of the plant medicine, and it absorbs into your bloodstream more, like right away, because it's alcohol based. So it literally helps you from the inside out, where essential oils, they'll sit and they can burn your gums and your teeth and even your esophagus, your stomach. It's like a whole, just thinking about it gets me stressed. Please don't use essential oils in your oral care or put it directly on your skin ever. Okay? Glad we had that discussion, everybody. Listen to me, please. And please don't put it on your kids. Oh, that's a whole other thing. I'm going to get stressed talking about it. Let's move on to monitoring your gum health as a pregnant woman. So with pregnancy hormones, they rise and they're like sometimes spike and then they lower all throughout pregnancy, right? Which pregnancy gingivitis can happen, which is great, but annoying because it can just affect you long term, even after having kids. So pregnancy gingivitis is when your gums start to recede back during pregnancy due to your hormones, which is why women tend to get more cavities. And that's what's happened to me. And it sucks because even though I use a soft brush, boar brush, it's like your body's just more sensitive. Holistic dentists would probably offer a natural anti-inflammatory rinse, more gentle cleanings, and then nutritional support to help stabilize the gums. I asked a few family and friends, and like no one really offered much help in this, if I'm going to be 100% honest. So I've just been more gentle with my cleaning. I still clean in depth, but I'm just more gentle about it. And I really focus on like tongue scraping to help rebalance the gut biome in my mouth. So cautionary things to maybe postpone during pregnancy. Any type of mercury, anything. If you decide to do any type of mercury fillings or metal fillings, wait until after pregnancy. It's not recommended even in allopathic medicine due to mercury vapor release. So even holistic dentists will like want you to wait until at least postpartum or not do them at all. But if it's absolutely necessary, they can use a SMART protocol, which is called safe mercury agnolium removal technique. But most people would probably say no. So that's even in removal, mercury filling or mercury removal, they won't do it. So it's not like while you're pregnant, you can just get all those removed, because the vapors of them drilling into your tooth will go into your respiratory system and can cause mercury issues for you and baby. Root canals and extractions. So obviously this happened to me. It can be done if it's medically urgent, right? Which is what I experienced. But a holistic dentist will often try to stabilize the tooth just during pregnancy and then deal with it afterwards. You can use ozone or temporary fillings, but it only buys time until postpartum, which is what we almost did. But they had to drill so much of the tooth, and they didn't want me to, like, I wouldn't be able to chew anything up. And like during labor, you bite down, like it just was not an option for me personally. But any root canals and extractions, if they can be prevented, they should be. This is another one too. Any type of biocompatibility testing for dental materials. So this is all usually postponed, and something must be done, unless something must be done, like placing a crown on or a composite. But they can offer like testing and peace of mind for you. But in the meantime, you want to keep your blood and your saliva from overproducing in your mouth, so that everything can kind of go straight to the nutrients of the baby. So yeah. Also too, if you get your teeth done, a lot of x-rays are involved. And that was one of the things I was freaking out about, because they had to x-ray my whole face and individual teeth over and over again, even after they worked on it to make sure nothing was bad. So they I've made them triple up on putting the x-ray things over my belly and my back and my breasts. So, yeah, if you can avoid doing x-rays, even with a double or triple shield, just don't do it. I had so much anxiety. I had more anxiety doing that than anything else, actually, with Penelope. I was praying over her the whole time. So yeah, try to avoid x-rays. And also too, bonus tip for pregnancy and oral care routine in general, tongue scraping, man. It reduces bad bacteria so much morning and night. Just if I had to choose between brushing my teeth and scraping my tongue day and night, I would literally choose tongue scraping all day. Brushing also with hydrogen peroxide once a week. I do that. I haven't done it a ton during pregnancy because I didn't want to swallow it, but that also resets my mouth beautifully. And then I do the mineral toothpaste afterwards. Herbal salts and waters or chamomile rinses. Hello. So good for your mouth. And chewing xylitol gum, but not swallowing it. So chewing it can also reduce cavity causing bacteria in your mouth as well. Or even like the sap. A lot of people use I forget what that sap is called, but they're doing tree sap gum mixed with xylitol and other things. So yeah. And this was something that a lot of people were asking me about consistently. And I'm really glad I got to do this episode and record it really quickly, especially because I actually have to go to the OB in a hot minute. So I'm glad I was able to record this and get it done for you guys this week, because I missed recording for you guys and I'm so sorry. So much has happened these past few weeks, but yeah. And we also almost thought baby was coming last night for a hot minute because a part of my water broke and then resealed. So I want to record a bunch this week if I can and have batch episodes to be able for you guys to listen to. I wonder if a few of you thought I was in labor or had the baby because we missed. But no, just stress happened. Broke my tooth. And then our neighbor was crazy. We had to call the sheriff. So it's just been a lot. So please be praying for us. And I hope that this was helpful, whether or not you're pregnant, to be able to look into holistic dentistry and care. I am following someone on my Instagram. If you guys look up holistic dentist, I'm following him. He's in Carlsbad, but he also has a lot of referrals on his website to people all over the country. So maybe check him out. I can't remember his name right now. But yeah, if you guys are following me on Instagram, which is holistic_wife, you'll be able to see that. And also you get to see just, me being crapped on lately on all my Instagram posts, talking about positive birth experiences and positive pregnancy experiences that for some people, for some reason, they don't believe. And then it's just wild. People are wild on the internet. But I love you guys. I'm so sorry. We've been so busy. And I hope and pray that this is really encouraging for you. And I can't wait for this to air on Wednesday. Until then, per usual, Keep God's light and love in your life. Keep his word solid daily and be in prayer and community daily. And as always, keep casting seeds.
We hope you enjoyed learning how to cultivate God's creation from a biblical perspective. Holistic health is to prioritize whole person wellness through Christ. Like and comment on what topics we're casting seeds or casting pearls.
If you found this information provided useful, subscribe to our podcast for future updates, leave a review to help us improve, and share this episode. We would like to remind you before we leave that perfect health cannot be attained in this world.
Only spiritual salvation through sanctification and repentance to God and turning away from sin will give you a perfect body in the kingdom come. Nourish yourself in the word, in prayer, and in biblical fellowship daily.
Thank you for joining us today, and a special thank you to our listeners for making this podcast possible.
Always praying.
Keep casting seeds.